Let's now talk about kidney 5 or the water spinning point as we continue to discuss the Xi-Cleft or the accumulation points. Kidney 5 is located 1 tune distal to kidney 3 in a depression over the joint space between the talus and the calcaneus. How to find kidney 5? First, we locate kidney 3 on the level of the highest prominence of the medial malleolus in a depression between the malleolus and the Achilles tendon. From kidney 3, palpate 1 tune in an inferior direction to a palpable depression over the joint space between the talus and calcaneus. This is the location of kidney 5. We needle kidney 5.3 to 0.5 tune obliquely to vertically superior to the margin of the bone. As for its actions and indications, kidney 5 regulates the Chongmai and Renmai and benefits menstruation and urination. For its special features, kidney 5 is the Xi-Cleft point of the kidney meridian. It is specially indicated for acute disorders and painful condition. Being the accumulation point, kidney 5 can be used in acute conditions to stop pain and is therefore used in acute cystitis and urethritis. It also stops abdominal pain around the umbilicus and it regulates blood in the uterus. In particular, it is used for amenorrhea from kidney deficiency. To summarize its function, kidney 5 benefits urination in difficult urination or dribbling of urine. It also regulates the uterus and menstruation in cases of scanty menstruation, in scanty periods, amenorrhea, irregular menstruation, painful periods, and prolapse of uterus. Kidney 5 is the Xi-Cleft point of the kidney channel. The Xi-Cleft points are where the qi and blood, which flows relatively superficially along the channels from the genual points, gather and plunge more deeply. The Xi-Cleft points in general are indicated in the treatment of acute conditions and pain because the Xi-Cleft points of the yin channels have an additional action of treating disorders of blood. There is an intimate relationship between the kidneys, the uterus, blood, and menstruation. The essential question says, the vessel of the uterus connects with the kidneys, and at the age of 14, the Tiangui matures. The conception vessel flows and the penetrating vessel fills. The menses come according to the times, thus conception is possible. Normal development of the uterus and the conception and penetrating vessels depend on healthy functioning of the kidneys and maturation of the kidney essence. At the same time, harmonious menstruation depends on adequate formation of blood in the body, especially the liver blood, which flows to the conception and penetrating vessels to form menstrual blood. The close relationship between the kidneys and the liver blood was emphasized in comprehensive medicine according to Master Zhang, which said, when the essence is not discharged, it will return to the liver and transform into clear blood. Because the kidneys themselves plays an important role in the formation of blood, stated unequivocally in disease mechanisms according to Master Sha. The source of blood is the kidneys. If the kidneys are deficient, then the function of the conception and penetrating vessels will be disturbed and the formation of blood impaired. Kidney 5, the Xi-Cleft point of the kidney channel, and thus able to treat disorders of blood, regulates the qi and blood in the kidney, conception, and penetrating vessel. It is indicated for a variety of menstrual disorders such as amenorrhea, irregular menstruation, dysmenorrhea, and delayed menstruation with oppression and pain below the heart on onset of menstruation. whether characterized by deficiency of blood or Qi, or excess in stasis of blood. As for point combinations, amenorrhea with oppression and pain below the heart. Kidney 5 can be used in combination with kidney 6. For irregular menstruation, kidney 5 can be combined with stomach 25. For uterine prolapse, kidney 5 can be combined with kidney 6, bladder 62, and liver 8. Thank you for your attention.